Have you ever experienced this pain? A throbbing ache that starts from the back of your neck and progresses to the top of your head? Yes, you guessed it right. Our topic today is blood pressure. Blood pressure is the pressure of the blood in the arteries as the heart pumps it around the body. There are two types of blood pressure measurements, systolic and diastolic. Systolic pressure is the highest pressure during heartbeats, and diastolic pressure is the lowest pressure between beats. A healthy blood pressure level is considered to be below 120 mm of mercury systolic and below 80 mm of mercury diastolic. High blood pressure can lead to serious health problems like heart disease, kidney disease, and stroke. Blood pressure is typically measured using a blood pressure cuff. This device has a cuff that tightens around your arm and a gauge that measures the pressure. During the measurement, the cuff is wrapped around your arm and inflated. This temporarily stops blood flow, and as the cuff slowly releases air, the device measures your blood pressure. There are many causes of high blood pressure, including genetic factors, dietary habits, excessive salt intake, lack of physical activity, stress, and certain health conditions. Managing high blood pressure is a multifaceted approach, blending lifestyle modifications with potential medication. We'll guide you through the dietary recommendations, the DASH diet's benefits, and how physical activity can fortify your heart. Medication plays a pivotal role for some, and we'll discuss the various types, from ACE inhibitors to diuretics, and their mechanisms of action. A diet for individuals with hypertension should be designed to help control blood pressure. This typically involves limiting sodium intake, increasing intake of potassium, magnesium, and fiber, and maintaining or achieving a healthy weight through a balanced diet. Low sodium diet. Aim to limit daily sodium intake to between 1,500 mg and 2,300 mg. Be mindful of hidden salts in processed foods, fast food, and prepared meals. Foods rich in potassium. Potassium can help lower blood pressure. Incorporate foods rich in potassium into your diet, such as bananas, potatoes, tomatoes, beans, yogurt, and fish. Whole grains. Choose whole grain products over white bread, rice, and pasta. Whole grains like oats, brown rice, and whole wheat bread are beneficial due to their higher fiber content. Fruits and vegetables. Eat at least 5 servings of fruits and vegetables each day. They provide the vitamins, minerals, and fiber your body needs. Lean protein sources. Limit red meat consumption and opt for lean protein sources. Chicken, turkey, fish, and legumes are healthy protein options. Healthy fats. Reduce intake of trans fats and saturated fats. Opt for foods containing monounsaturated and polyunsaturated fats, such as olive oil, avocados, and nuts. Limited alcohol and caffeine consumption. Limit your intake of alcohol and caffeine, as these substances can temporarily raise your blood pressure. Adequate hydration. Aim to drink at least 8 glasses of water a day. Adequate water intake helps your body functions to operate smoothly. Regular physical activity. In addition to a healthy diet, regular exercise also helps to keep blood pressure under control. Do I need to take blood pressure medication for life? Not necessarily. The duration for taking blood pressure medication depends on various factors, including your blood pressure levels, overall health, and lifestyle changes. Some individuals may need medication long-term to manage their blood pressure effectively, while others might reduce or discontinue medication under their doctor's guidance, especially if significant lifestyle improvements and weight loss are achieved. Can consuming caffeine cause long-term increases in blood pressure? Caffeine can cause a short-term increase in blood pressure, but its long-term effects are less clear. Research indicates that people who consume caffeine regularly may develop a tolerance, diminishing its long-term impact on blood pressure. However, if you have hypertension, it's wise to monitor how caffeine affects you and consult with your healthcare provider. Is high blood pressure only a concern for older adults? No. High blood pressure can affect individuals of any age, including children and teenagers. Lifestyle factors, obesity, and genetic predispositions can contribute to high blood pressure in younger populations. Early detection and management are crucial for all age groups. If I have no symptoms, does that mean my blood pressure is fine? Not necessarily. High blood pressure often has no symptoms, earning it the nickname, the silent killer. Regular monitoring is essential for early detection, as you may not experience noticeable symptoms until significant health damage occurs. Can high blood pressure be cured? While there is no cure for high blood pressure, it can be effectively managed through lifestyle changes, medication, and regular monitoring. Managing blood pressure is a lifelong commitment to prevent complications and maintain overall health. Is it true that only salt intake affects blood pressure? While excessive salt intake can raise blood pressure, it's not the only factor. Other contributors include lack of physical activity, poor diet, obesity, stress, and excessive alcohol consumption. A comprehensive approach to lifestyle changes is necessary for effective blood pressure management. Can stress alone cause high blood pressure? Stress can temporarily increase blood pressure, but the direct long-term impact of stress alone on developing chronic high blood pressure is less clear. However, chronic stress may lead to unhealthy habits that increase your risk of hypertension, such as poor dietary choices, increased alcohol consumption, and reduced physical activity. As we complete our journey into the intricacies of blood pressure, we emphasize its role as a vital health indicator. With the right information and tools, managing blood pressure becomes an empowering aspect of healthcare. Thank you for joining us in this comprehensive research. Remember, taking control of your blood pressure means taking control of your health. Be informed, be proactive, and most importantly, stay healthy. Thank you for watching, and we wish you good health. Don't forget to follow our channel for crystal clear health guidance. If you liked the video, you can press the like button.